how the U.S. healthcare system responds to the challenge of changing personal behaviors. If personal behaviors are the most important contributor to poor health and premature death, how does the U.S. respond to this problem? The U.S. responds by spending more money than any other country on healthcare per person. But to understand exactly how the U.S. healthcare system has addressed the problem of personal behaviors, it's important to look at how the money is spent. Up until recently, the U.S. healthcare system has operated under a fee-for-service system, where whatever procedure or service is delivered, that service or procedure is reimbursed. And what that has led to is a system where more expensive procedures are favored over less expensive procedures. So getting an MRI or doing a complicated surgery is going to have greater priority than providing counseling for behavior change, for example. So under a fee-for-service system, there's a financial incentive to wait for a smoker to develop heart disease and need to be flown by helicopter and landed on a roof of a hospital and then get a stent to open up their clogged coronaries. That is going to be a greater gain for a hospital than to provide counseling 20 years before then to help somebody stop smoking. The payment system also leads to specialization among physicians. So if procedures are going to be reimbursed at a higher rate, then there's going to be a shift in the physician workforce towards procedure-based specialties and away from primary care or less reimbursed areas of physician specialization. Another aspect of the healthcare system is that most federal dollars for healthcare flow through hospitals. So this contributes further to the tendency for care to be highly technical, procedure-based, and less so community-based or focused on preventive care. And the numbers bear this out. Because of the less reimbursement for primary care, there's a growing shortage of primary care physicians in the United States. But even if we had enough primary care physicians, the time constraints are enormous. So it would require a physician to work their entire day to deliver all of the services recommended for prevention. And this is reflected in low rates of delivery of preventive services, such as counseling for tobacco cessation, which is only at 20% for smokers. Finally, when we do deliver interventions for changing personal behaviors, we tend to use the same approach that we use when we're treating medical conditions. So if somebody comes to a physician and has a cough, the role of the physician is to diagnose the illness and to provide recommended treatment. The same approach tends to occur with personal behaviors. So if somebody comes to a physician who is obese, the tendency is to diagnose the patient as obese and to provide treatment, which is to tell the patient to lose weight. And this traditional approach leads to very poor adherence by patients. Patients don't tend to respond to a provider's advice to change behavior in the same way they do to a provider's advice to get a CAT scan or to be admitted to the hospital for a procedure. And we'll talk about this further, why the traditional approach to behavior change tends to backfire.